Hi everyone, my name is Chelsea Tibbetts and you have tuned in to the Increasing Participant Engagement and Enrollment webinar for the First Breath program with the Wisconsin Women's Health Foundation. We appreciate you taking the time to join us and making this a priority, especially as we all wind down from 2016 and prepare for the new year. The question to start us off is why a webinar on increasing enrollment? The First Breath program chose to focus on this topic for a number of reasons, including, first, that enrollment numbers have decreased over the past 2 years. Our program has seen a decline in the number of participants enrolling in First Breath services. Secondly, we want to highlight how goal setting positively affects enrollment and show outcomes of goal setting over the past 4 years. So let's get started. By the end of this session, we will review lessons learned from 4 years of First Breath enrollment goals, offer ideas, skills, and techniques to help you set and reach your 2017 goals, and identify strategies to increase participant engagement and site enrollment. Here is the agenda for what we will be covering in this short presentation. First, we will start by reviewing lessons learned from the past 4 years of enrollment goals, followed by suggestions to consider when selecting an enrollment goal, and finally, tips for reaching that selected goal. I also want to mention that if you know anyone who was unable to tune in with us today, the session will be recorded and available for view at a later date. Please stay tuned for announcements in our January monthly e-newsletter for this information. As you can see, this graph compares monthly First Breath enrollment over the past 4 years, with the most recent data being represented by the bold red line. While overall First Breath enrollment has gone down, and we do acknowledge that this is due to a number of factors, some of which we cannot control, our experience shows that sites who intentionally set enrollment goals and actively work toward them have seen their enrollment maintain or increase during this same time frame. For this webinar, we will focus on factors that sites and providers can control to optimize their participant engagement and enrollment for 2017. Having asked sites to begin setting enrollment goals in 2013, we have a few years of experience under our belts. So let's talk about what we've learned so far. I mentioned that sites who intentionally set enrollment goals and actively work towards them have seen positive outcomes over the past 4 years. Here are a few examples from our engaged sites. Site A. Site A set a low but achievable goal in their first year. Between 2010 to 2012, this site enrolled an average of 1 woman per year, but since 2014, they have enrolled 1 woman per month, an incredible result from start with a simple goal. Site B. Since starting to set a goal as an organization, Site B has actually doubled their annual enrollment. Their enrollment in 2011 to 2012 compared to that in 2015 to 2016 has doubled. And finally, Site C. Site C set their first enrollment goal in 2013, and for 2 years in a row, they doubled their enrollment, as well as their goal. They continue to maintain higher enrollment levels than most sites to this date. On the other hand, sites who set goals unintentionally and are unengaged in working towards them, or sites who don't set enrollment goals at all, tend to lack the participant enrollment altogether. Here are a few examples from these more unengaged sites. Site A. Site A has only set 1 goal in the past 4 years. During this time, enrollment has gone down significantly for this site, despite a large staff of trained providers. Excuse me, I meant Site D. Also Site F. Site F. This site set their initial goal in 2013, but have not done so since then. Unfortunately, they have seen no enrollment since this time. These examples provide a great insight as to the benefit of intentionally setting goals and actively working toward them. Here is a list of other common factors between sites that achieve their enrollment goals. One is that program providers at these sites are actively engaged in the program, meaning they partake in at least 1 continuing education opportunity annually, including the statewide meeting or the regional practice sessions. Now, not only do they engage in person, but they also read through the content of our monthly e-newsletter to stay up to date with announcements and events. Finally, they confirm accurate enrollment by reviewing the monthly enrollment reports included in the e-newsletter and their own records. Building on this, another factor that supports site enrollment is communication of staffing needs and changes over time. This includes training needs for new staff members as well. Third, sites with success in this area understand the importance of addressing tobacco as a prenatal care issue. They acknowledge that carbon monoxide is the #1 fetal toxin, that prenatal tobacco use continues to be the leading preventable cause of poor birth outcomes, including low birth weight and premature birth, and they see how tobacco use affects all facets of family health. Tobacco continues to be a priority on their treatment plan. A final factor is the identification and the application of effective procedures to implement First Breath programming throughout the entire prenatal care organization. First Breath is a known name throughout the differing departments. There are posters and materials promoting the service, all of which allow for more effective access to services and referrals to the correct staff members. Now that we've explained why we are concerned with enrollment and what we've learned about enrollment goals over the past 4 years, let's talk about some points to keep in mind when you are setting a goal for 2017. We are asking sites to set enrollment goals because they work. Having an established goal, which someone is holding you accountable to, makes you more likely to succeed. 2013 was the first year in which enrollment goals were used, and the impact, even in this first year, was noticeable. In 2013 and 2014, site enrollment increased by nearly 20% from 2012. That's nearly 250 more women receiving help than in the previous year. Again, goals work. Setting goals assists First Breath in a variety of areas. Accountability. Between our organization and the First Breath site, there is a sense of accountability. As previously mentioned, enrollment reports are communicated through our monthly e-newsletters, and in addition, quarterly check-ins are sent to sites with updates on the progress towards their goals. Again, this is a great time to ensure that your records match ours. Have forms been completed, submitted, and successfully received? One way to simplify this, which we will discuss in more detail in a minute, is to utilize our online data entry system. Second, planning. Having an idea of how many participants may be utilizing services in the coming year allows us to account for the quantities of materials needed, sites that may need on-site training set up, and next steps in programming. Also, as more women are enrolled, it is easier to advocate for program expansion needs in your areas, such as First Breath Families, which assists First Breath moms with relapse prevention in the postpartum period. Third, improvement. Enrollment goals also indicate to us areas for improvement, such as access to services, leading to improved outcomes for your clients and your community. Finally, program sustainability and funding sources. As our team works hard writing for grants and exploring opportunities for continued program expansion, enrollment goals give us a platform to speak on regarding the number of women who can benefit from the partnerships we have with caring and talented providers like you throughout the state. When setting enrollment goals, let's talk about some factors to consider. First, has your site's First Breath enrollment changed significantly over the past year? If so, what has changed? With this, it is going to be most effective to try and identify factors that you can impact or influence. Feel free to check your recent e-newsletter with these statistics or connect with one of our staff directly. We're happy to help in identifying these changes. Number 2, another factor to consider is how many staff are actively enrolling women. Generally, the more staff you have trained, the more women you can enroll. But one important point to note here is the word actively. In our experience, One highly motivated staff member will enroll more women than a dozen staff who are trained but less involved. Identifying your site's champion is an opportunity to celebrate their commitment, recognize and award ownership of the success, and keep other providers motivated as well. Third, along with the previous point, we have to think about the current caseload. The more women you're working with, the more women you could enroll. Perhaps this is also a time to revisit your process for identifying women with a history of tobacco use and how they are being invited into services. Are there gaps between being offered the service and actually enrolling into it? It's also very important to keep in mind the smoking rate of the population you're working with specifically. Maternal smoking rates vary based upon a number of factors. According to the most recent WISH dataset from 2015, the overall average for maternal smoking in Wisconsin is about 12%. That's nearly 1 in 8 pregnant women in Wisconsin identifying themselves as tobacco users. It's important to note that this is the average for the state as a whole. Looking at county-specific data, which we'll highlight in the next few slides, you can find rates between 5.1 and 36.8%. Risk factors to consider when looking at your specific population include women who are younger, of lower education attainment, unmarried, and of low socioeconomic status, as they are significantly more likely to be dealing with this addiction. Dr. Karen Palmersheim's report, Smoking During Pregnancy in Wisconsin, an update on trends and patterns, from the University of Wisconsin-Milwaukee's Center for Urban Initiatives and Research, also highlights these factors in more depth. Identifying your site's maternal smoking rate specifically familiarizes how often you could expect a woman to be eligible for first breath. When setting your goal, look into data available about your patient base's tobacco use. The annual site-specific report from First Breath may be of use to you as well. This map shows the maternal smoking rate of each county from 2013. This information is from the WISH database and is based on birth certificate data. Darker counties report higher rates, while lighter counties show lower rates. Again, this map simply emphasizes the point that the state average is truly just an average. So not only is the state average one we have to consider, we also have to consider the averages for the counties, as this can vary greatly from your specific population. Even in communities with low tobacco use rates, disproportionately affected women are still using tobacco at the same rates despite geographic location. Again, consider those risk factors such as age, education, marital status, income, and insurance status. One example of this is that in 2015, Dane County had a rate of 6.2% of pregnant women using tobacco. However, the low-income women, which is based on Medicaid being the primary source of payment for birth, used tobacco at a rate of 18% during pregnancy. Again, it's about knowing your population. I mentioned the Dane County's maternal smoking rate for 2015, and a new map is being developed based upon the updated county rates from the 2015 WISH dataset. That is shown here. While some counties are showing improvement, others are continuing to see this as a challenge for their population. We encourage you to take a deeper look into your community's history of maternal smoking rates. And when it comes to setting your site's enrollment goal, think about how you can ensure you're capturing your population accurately. Again, we'll be developing a map with the updated 2015 rates, and please be aware of this in upcoming announcements. So after you've set your site's goal, let's talk about effective ways to actually reach it. First things first, women need to be invited to the program. Think back to that number of eligible women. Were you surprised by the number? Most likely, improvements can be made to increase awareness of the program and ensure every eligible woman is offered participation. After all, if a woman doesn't know about First Breath, how can she enroll, right? Perhaps revisit the process at an upcoming meeting and ensure everyone's familiar with their roles and responsibilities to get women involved. Another suggestion is to start early. If you're new to our programs or just haven't utilized them in a while, push yourself to start early in reaching women in 2017. Historically, 85% of sites that achieved their goal enrolled someone in the first 3 months of the year. Among those sites that didn't achieve their goal, only 45% enrolled women in this time frame. Start early, and it's much easier to reach your goal. Also, practice the process. If your site's maternal smoking rate is low, meaning you aren't seeing pregnant women who smoke on a regular basis, it's very easy to fall out of practice. If you notice that this is the case for you, take a few minutes to brush the dust off your training materials or a participant folder and refamiliarize yourself with the process. Upon doing so, please connect with our staff for any questions. And as challenges arise, or if you already have a list forming in your head, think about next steps. Identify challenges within your staff, but more importantly, a plan to address them. Once plans for first breath engagement and enrollment have been set, we suggest reevaluating them throughout the year. Successful sites integrate this conversation into regular meetings, keeping the topic fresh and a priority for staff. When creating your plan, make enrollment easy. Here are some ideas to do so. First, be sure you have what you need. Where are the folders and the data forms kept? They should be accessible for convenience and ease. Also, do you have the most updated forms? Become comfortable with the contents before your visits. This will certainly make the process run more smoothly. Also, who's in charge of keeping materials stocked? Are the incentive gifts within reach to hand over? How does this process work for your site? And is the current process actually working? Is staff trained? Is staff actively offering the program to women? How does your site track this, and how can we help? All of these factors to consider, but one larger goal to strive for, which we have mentioned a few times now, is to truly make First Breath part of your conversation at regular staff meetings. This includes identifying strengths and success, as well as barriers needing to be addressed. Some sites, including one that I actually met with earlier this year, may actually come to find out that there is a big gap in services, such as who's actually enrolling women. In this case, the medical assistants thought the nurses were, the nurses thought the doctors were, and the doctors thought the medical assistants were. So when everyone thought someone else was enrolling, they realized they actually weren't enrolling anyone at all. They very quickly changed the process and now are being very successful. So addressing these needs might take some rearranging and logistical attention, but it will create a smoother process for yourself and for your participant. And as always, we are more than happy to help. One of the biggest things that can help you reach your goal is to improve upon your introduction or delivery. If introduction is an area that you're not super comfortable with or confident in, practice, practice, practice. Again, this could even be integrated at a team meeting or monthly check-in. The more comfortable you are with the program content, surveys, and data forms, the easier the words will roll off your tongue, providing confidence to the participant that this is a program worth taking part. Here are some suggestions from other First Breath providers like you. We use the word service versus program. I emphasize that it's a way to quit or cut back. They don't feel pressure to quit if they're not ready. We let women know that if they've already quit, they can still join and recognize their successes. We tell our patients, we are going to talk about it anyway, you might as well receive some incentives. We frame First Breath as an add-on or extension to the services already being offered, instead of a new program. And finally, we highlight the texting program for additional support and let them know that there aren't any extra appointments. What about common barriers that our sites see? How do these affect enrollment as well as participant engagement? For those who report women simply not being interested, make sure you're presenting the program in terms of how it could benefit her, not just how it will benefit the baby or how it's the right thing to do. Personalizing the introduction makes it feel much more intriguing to participants and knowing what they will get out of it themselves. What about if you feel women aren't disclosing their use? If you're in this situation, try rethinking the situation from their perspective. This is a very, very personal topic. Are you doing everything you can to make women feel comfortable disclosing tobacco use? What about how you're asking the question about use? Something to the effect of, tell me about your recent tobacco exposure, can open up the conversation much more than, are you still smoking? And one recent barrier we've heard is the decline of referrals. Sometimes this is not a factor that we can control, but we do encourage you to think about a few things. First, where were your referrals coming from originally? Are there other places that are offering prenatal care in your area and don't know about your services? It is helpful to figure out the issue and take proactive steps to solve it. A few final tips and suggestions from sites that we see engaged. Number 1, experiment a little internally with various methods of promotion and marketing. Test out 2 or 3 ideas and see which has the best results. Posters in the waiting room, brochures in your new OB welcome kits, maybe a display at your front desk. How about showcasing the incentive gifts? Ask us for supplies and assistance. Also, make it easy to start the conversation. If there's a pregnant woman who's using tobacco at your organization, everyone should know what First Breath is and how to get the woman connected with the right people on your staff to get her enrolled. One site recently told us, we use the monthly enrollment report as motivation. It gets shared every month at the staff meeting, and we compare our numbers to other sites in the area. The quote-unquote competition keeps us going. The biggest takeaway from this is the importance of keeping track of enrollment in some way to ensure that we're receiving all of the enrollments that you're putting your hard work and time into. And lastly, through online data entry. You don't have to worry about faxes not coming through, mailings being delayed, or other barriers to receiving forms. It's quick, it's easy, and most importantly, it's secure. So to wrap up, let's discuss next steps. First, do your math, have a conversation, and make a decision about your goal with your team. Make sure you've considered your population and that of your surrounding community using the factors discussed earlier. Upon receipt of your site's annual Memorandum of Understanding, we will be in touch to request your site's enrollment goal. Following up will continue on a bi-monthly basis through email updates from our health educator, Lauren. Lastly, figure out what needs to happen to reach that goal. Meet to discuss a plan of action, make adaptations as needed, or continue to succeed as you are. We're always here to assist with the step as well. Overall, we encourage you to start small and do what you can. Getting started on something now is much better than planning out some larger grand plan for 6 months in the future. We've come to the end of the webinar, but that's really just the beginning of our planning for 2017. At this point, we want to thank you and encourage you to keep the conversation moving, and we welcome at this point as well any other questions. Okay, some questions that came through. How can I get more of my staff interested and involved? Great question. First suggestion would be schedule a training. We have some wonderful staff that can come on site to you. We can do this in a time frame that seems reasonable for your organization, and we can absolutely get everyone up to date on the newest pieces of First Breath, what it can bring to the organization, and what it can bring to their participants. Another suggestion would be really be a model around being a champion around this issue. So you yourself, you're tuned into this webinar. It's a week before Christmas or a few days. I suppose I'm off on my calendar a bit. And you're making the time for this. So being that model, showcasing it as something that is a priority for your organization, I think that'll absolutely get more staff interested and involved. Okay, another question. I'm new to the program and I'm the coordinator to my site. I have no idea what to set as a goal. That is absolutely valid. My suggestion would be communicate with us, contact us. We are happy to look at your site specifically, look at your community, look at your county's rates, and take all those factors into consideration to help set a goal that's specific to you and also just feels good to you. One other thing I should mention about the goals is that they're truly just a goal. It's something that we want to help you guys strive towards, motivate you to get women enrolled. There's not going to be any repercussions if it's not met or if halfway through the year you want to change it. Again, answer that question. Absolutely contact us, communicate with us. We are more than happy to assist. A question came up about e-cigarettes. A lot of the clients are using those, but they aren't using tobacco. Can they be in first breath? Wonderful question. We do get this one. From our perspective, we would say yes. So because the e-cigarettes are containing nicotine, which is, again, potentially harmful to the mom as well as the unborn baby, we would say please enroll them. Offer them the same support that you would through first breath that you would if they were reporting regular cigarette use. Our data forms do specify cigarettes, but that is something that you could write in if you wanted to use a paper form or just communicate with our data entry staff so that we know to convert it over for e-cigarette usage. But yes, please enroll them still, regardless if they're just using e-cigarettes. And then one other thing I would mention on that is that we do have a brochure on pregnancy and e-cigarettes specific to first breath. So it's something that we created internally so that we could update it as the new information is coming out and as research continues to build on this topic. I have a couple other questions. Thank you guys. Keep them coming. Regarding client engagement, once I get a woman enrolled in first breath, I have a hard time with follow-up. Either they don't come back for a visit or they change their mind. What should I do? This is an awesome question. First and foremost, I think it probably is going to be a case-by-case basis. Also, depending on the ability for you to be able to reach out in different ways, whether it's phone, in person, other options like that. One suggestion could be following up more regularly. So although First Breath only asks you to complete 3 visits throughout the pregnancy, that doesn't mean that that's all you can do. So if you can follow up more regularly, if maybe you can send a text message and just check in and see what they're doing, how their cessation is going, that would be a great option. Also, maybe just asking why they changed their mind, letting them know that it's okay. Sometimes participants will relapse or slip, and they are feeling very conflicted in telling their site about that or their provider about that because there's that feeling of guilt or shame. Kind of normalizing this and letting them know that it's absolutely okay, that you'll support them and continue to support them throughout. And I would say most of all, it's just really building on a genuine conversation and a genuine connection. And that's something that we are just in awe of with all of our First Breath providers, the work that you guys do and the continued effort that you put in to help women succeed it's really just amazing. So those would be a couple things that I would suggest. One other thing, actually, that things are keep coming to mind, get her signed up for Text Connect Quit. A lot of our providers will utilize that as another way to really highlight services, and it's a great way to keep the conversation fresh for participants versus having that feel like it's coming back on your shoulders and your time. So they can very quickly and easily sign up for that. They can text the word First Breath to the number 97779. So it's 9, 3 7s, another 9, and it's the keyword First Breath. And that's a free texting service for First Breath moms. They can receive 3 to 4 text messages a week that support them, motivate them, and remind them to come back and talk to you. It's a wonderful service, and it goes out to 6 months postpartum as well. The text messages are also specific to where they are in terms of their pregnancy. So they'll text us their due date, so we know to guide the messages based upon whether they're in their first trimester, their third trimester, postpartum. And we have somebody, actually a certified tobacco treatment specialist, on the other end that can answer questions or comments if there are any concerns that the first breath participant has. So that's another option as well. It can keep them engaged. All right. There's another question on here that I think is very real and relevant. If a woman is maybe resistant to help, she isn't interested in quitting, how can we help women who don't want help? And that's another thing that I would say comes back to building that connection. It's letting her know that even though right now isn't a great time for her in her life to make this change, you're going to be there and willing to help her when it is. Maybe see if she's interested in different goals. Maybe the goal isn't even surrounding her tobacco use and cutting back, but it's just having a conversation with her family members about whether or not that would be something that they would be supportive of. Or, really focusing on smaller steps and just utilize your motivational interviewing. There's going to be a lot of women that this is just something that isn't on their frame of mind right now, and that's okay. But one thing that we know is that tobacco use in pregnancy continues to be that #1 issue. It's still the leading preventable cause of poor birth outcomes. We know that it affects not only the mom and the baby, but the entire family. And I would say have the conversation at the pace that they're willing to have it and willing to go, and just continue to revisit and let them know that you're there for them when they're ready. Any other questions from the group? Well, if they do come, please let us know. You can email us, you can call us, and we just really appreciate you tuning in to the First Breath webinar. I will again have this as a recording, so you can view it at a later date or share it with other of your staff members who are interested. From the First Breath program and from the First Breath team, we want to wish you the happiest of holidays. Thank you again for tuning in, and we'll see you in the new year.